Well, everyone has a vested interest in improving the quality of care. Those who pay for care, those who provide care, and the consumers who receive the care. All of them need to work together to improve the quality of care.
We all are there because we want to provide what's best for the patient.
It's not something that one entity can accomplish.
If we can get these different individuals, organizations, entities within our community really to work cohesively in the interest of addressing our issues locally, I think that's huge. I really do.
Everybody obviously is coming from a different perspective, but people are trying to come, if you will, by aligning themselves with what we think we need to achieve.
We're not getting together complaining about health plans or anything else. We're actually getting together and talking about how to improve the health of our community and improve the care that we provide. This is the first time in our community we've actually started talking about things that are meaningful. These are the things that brought me into medicine.
Robert Wood Johnson was smart enough to recognize there's a real void in our community, and that void is engaging consumers in understanding healthcare quality better.
You're the most important part of your healthcare team, and you have to be an active and involved member.
There are some consumers that probably will have a very hard time believing at any stage in their life that they actually have an active role. We know that healthcare only accounts for about 10% of all health outcomes, and the rest of the time consumers need to make everyday choices that lead to their good health. And if we can support them in making those good choices, we can have a fundamentally transformative process.
The great news thing about providers are that they're a pretty competitive group. When we produced our first report, one of our major medical groups was feeling pretty good about the result, and then they realized that everyone else had been gunning for them. And so they realized that they'd have to step up their game.
Our data is really valuable to providers. And we didn't know when we first started whether they would use it, and we have all been very gratified in learning and talking with them to find out that they are using the patient level data that we provide them, and they're making changes in their healthcare system as a result.
I would like to see it result in a total community transformation around improving quality by having the stakeholders make the appropriate changes within their organizations, not just a project that we do and the funding is gone, so the effect is gone.
The work we're doing, you have to be comfortable with ambiguity. A lot of people want that cookbook, they want to be able to check off that list and know where they're going. I keep telling people we're creating the cookbook, we're creating the template.